Hello everyone, now let us discuss about 2023 CPT coding guidelines for special otorhinolaryngological services. This comes under the medicine chapter of CPT. Coming to the guidelines, the diagnostic or treatment procedures that are reported as E&M services, which are included in the E&M services. For example, otoscopy, anterior rhinoscopy, tuning fork test, removal of non-impacted semen. They are not reported separately. These procedures which are included in the E&M services, they are not reported separately. Special otorhinolaryngological services are those diagnostic and treatment services that are not included in an E&M service, which are office or other patient services. It can be new and established patients or office consultations, which come under the category 992422, 99245. The codes are 92507, 508, 520, 521, 523, 522, 524 and 526. They are used to report evaluation and treatment of speech sound production, repetitive language and expressive language abilities, voice and resonance production, speech fluency and swallowing. And evaluations may include examination of speech sound production, articulatory movements of the oral musculature, oropharyngeal swallowing function, qualitative analysis of voice and resonance, and measures of frequency, type, and duration of stuttering. And they may also include the patient's ability to understand the meaning and intent of a written and verbal expressions, as well as appropriate formulation and utterance of expressive thought. Now coming to the CPTs, the first one is 92502, otolaryngological examination under general anesthesia. Next is 92504, binocular microscopy, which is the separate diagnostic procedure. And the next is a revised code, and it is included in the telemedicine. Revised code is indicated by triangle symbol, and star mark indicates it is used in telemedicine. And 92507, they are treatment of speech, language, voice communication and or auditory processing disorder individual. Whenever it is performed for individual, you need to report 92507. Whenever it is performed on more than 2 or more individuals for a group setting, then you need to report 92508. The next CPT is 92511, which is nothing but nasopharyngoscopy with endoscopy. This is also a separate procedure. The next is 92512, nasal functional studies. For example, rhinomanometry. The next is 92516, facial nerve function studies. For example, electroneuronography. Next CPT is used to report the laryngeal function studies, 92520. It is used to report laryngeal functional studies which include aerodynamic testing and acoustic testing. And the next is also a revised code and the telemedicine code, 92521, evaluation of speech fluency. For example, stuttering and cluttering. Whenever stuttering and cluttering are evaluated and the test is performed for the evaluation of speech fluency, you need to report the CPT 92521. The next is 92522, evaluation of speech sound production. For example, articulation, phonological process, apraxia and dysarthria. Whenever evaluation is done to assess all these things, you need to report 92522. The next CPT is 92523, which is nothing but evaluation of speech sound production with evaluation of language comprehension and expression. For example, receptive and expressive language. And this is all these codes 92521, 522 and 523. They are used for audio only also. Here we are not mentioning that symbol. They are used for audio only also codes. The next is 92524. Behavioral and qualitative analysis of voice and resonance. And the next CPT is 92526. It is used for treatment of swallowing dysfunction and or oral function of feeding. Now let us see an example. A patient who is a singer has been hoarse for a few months following an upper respiratory infection. She is in a voice laboratory to have a laryngeal functional study performed. She is here for performing a laryngeal functional study which is performed by an otolaryngologist. And she starts off with the acoustic testing first. And before she moves on to the aerodynamic testing, she complains of throat pain and is rescheduled to come back to have other tests performed. And what CPT code must be reported here? Here, the patient is coming for the laryngeal functional study. If you see the CPT 92520, it involves laryngeal functional study, which includes both aerodynamic testing and acoustic testing. Here what happens? The patient starts off with the acoustic testing first. And before she moves, that is one test is performed. Acoustic testing is performed. And before she moves on to aerodynamic testing, the patient complains of throat pain and is rescheduled to come back to have other test performed. So here only acoustic testing is performed in this session. So you need to employ 92520 along with the modifier 52. If you see the description of this code 92520 in the CPT book, below you will find a note that for performance of a single test, use modifier 52. Modifier 52 is nothing but it is indicated to indicate reduced services. Whenever a procedure is not completely done, in order to indicate reduced services, we employ 52 modifier. Because only one test, that is acoustic testing, is performed here, you need to append 52 modifier along with the CPT 92520. Because here the patient is only doing acoustic testing and again she will come for aerodynamic testing later. So for this example, the appropriate coding is 92520 along with 52 modifier to indicate reduced services. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.